What's the difference between filler and Botox? Botox, or equivalents, which would be Xeomin or Dysport, they relax muscles. And by relaxing muscles, then the wrinkles that occur from the muscles diminish and are prevented. So forehead muscles pull your eyebrows up, and when you weaken that, you don't get heavy striations or lines that go across. Also, if you try and squint, I'm Botox, so you can't really see it, but when you squint your eyes this way, you'll get creases. Some people get one crease here, some people get two creases here, and some people get them coming across. So what Botox does is it relaxes that muscle so that then you cannot furrow as harshly or as strongly, and therefore you don't get those wrinkles. Then on the sides, what we do is if you squint your eye, this muscle right here, it contracts, and when it contracts, you see crow's feet. And also, so what Botox does is it relaxes that muscle, pops this open, and then it also gives you a nice little eyebrow raise. So if you have like heavy eyelids, Botox placed laterally and also centrally can help with that kind of heavy eyelid. It can help pop that up and give you a more youthful and feminine brow. Other areas that we can use Botox are around the lips. It causes a very slight curl upward, which just makes your lips look a little bit more plump. And it also prevents those pucker lines that you see a lot with people that purse their lips a lot, or if they smoke, or if they chronically drink out of straws. So note to self, stop drinking out of straws. And of course, we all know that we're not supposed to be smoking. So when you pucker, you form those lines, and if you Botox it, your pucker is just not quite as forceful, and those lines diminish over time, and you also get the added benefit of a lip that looks a little bit more full. Some other areas that you can use Botox in are the chin. Some people get kind of cobbly orange peel looking skin down here. What that does is it relaxes that so that then you are not, gosh, this ring light's driving me crazy. So that then you're not looking like you've got all those cobbles there. Other things that we can do with Botox is define the jawline. Often though, caveat that when you do this, it's often in conjunction with other products, just filler, or if you have little fat pads, then Kybella too, to kind of get rid of that. We'll talk about filler in a little bit. Other things, if you see, it's kind of difficult. Some people, when they chew gum or they gnash their jaw, you'll see the masseter muscle pop out. And what Botox can do is it can give you a thinner face. So if you feel like your face looks very boxy, that's another thing that aesthetically Botox can do, is if we inject the masseter muscles, it does create more of an oblong, elongated face. The other thing too is if you get quite a bit of pain from this area, then that injection in this area will help reduce that pain. Other areas that we can do Botox, I'm going to make a very strange face, but we can use Botox to prevent lines, what we call necklace lines, coming across the neck. And also if we inject up here in the superior portion of the neck, then it will also help give you a nice jawline. So I'm gonna do a face here that looks really bizarre. And you see that band there. People, that's called your platysmal band. It's right here. It actually pulls down on your jawline. So if you relax it, then that's what pops this jawline up and gives you that nice youthful lifted neckline. So that's pretty much, I think I've covered everything. Basics about Botox, Xeomin, or Dysport. They all work the same. And just to make everybody understand that this is not, I repeat, not botulism. It is a byproduct that is basically a quick little rundown of Botox. Thanks.